Hey everyone, welcome back to Targeted Science Studios. I'm David, and today we're going to talk about something a lot of men avoid thinking about, the prostate exam. If you've ever wondered what actually happens or felt nervous about it, stick around. By the end of this video, you'll know exactly what to expect step by step and why it's a normal, important part of men's health. And yes, we'll bust the myths so you can walk in confident, not worried. First, what is the prostate and why is the prostate exam important? The prostate is a small gland located just below the bladder surrounding part of the urethra. Its job is to help produce fluid for semen, but like any organ, it can develop problems over time, then from enlargement to inflammation and even cancer. Early detection is key. A simple exam can help your doctor catch issues before they become serious. Now, I know the idea of a prostate exam can be intimidating, but understanding what happens can completely change how you feel about it. So, when should men get their first prostate exam? Most men start around age 40 to 50, depending on family history. Higher risk men, African American men, or men with a father or brother who had prostate cancer may start earlier, around 40. Remember, getting a prostate exam doesn't mean something is wrong. It's a preventive health check, like getting your blood pressure measured. There are two main ways doctors check the prostate: the digital rectal exam, DRE, and the prostate-specific antigen, PSA, blood test. Your doctor gently inserts a lubricated, gloved finger into the rectum to feel the prostate's size, shape, and texture. The test is extremely quick, usually only a few seconds. The DRE can detect unusual growths or tenderness. Let's break down the digital rectal exam step by step so there are no surprises. You'll be in a private room. You may lie on your side, bend forward, or stand with your feet apart. The doctor will explain each step and answer any questions. A gloved, lubricated finger is gently inserted. It might feel unusual, but it shouldn't be painful. The doctor palpates the prostate, checking for size, shape, and lumps. You simply remove your gown, clean up, and you're done. Most men are surprised by how quick and simple it is. The PSA is only a blood test. It measures prostate-specific antigen in your blood. Higher PSA can indicate prostate enlargement, inflammation, or rarely, cancer. Sometimes both the DRE and PSA are done together for a more complete assessment. Now let's tackle the myths that make men nervous. Myth 1, it's painful. Fact, usually mild or just unusual sensation. Myth 2, it's embarrassing. Fact, doctors perform this daily. It's routine medical care. Myth 3, I'll lose control. Fact, absolutely not. No sexual function is affected by a simple exam. Understanding these myths helps reduce fear, and fear can actually make the exam feel worse than it is. So, what happens after the exam? For normal result, your doctor says your prostate feels healthy and your PSA is in the normal range. Any abnormal findings might lead to further tests like imaging or biopsy. The test results themselves are not a diagnosis. An irregular exam isn't automatically a cancer diagnosis, it's just a reason to investigate further. The goal is early detection and peace of mind. Here's the part many men don't realize. Early detection can literally save lives. According to the American Cancer Society, when prostate cancer is caught before it spreads outside the prostate, the 5-year survival rate is almost 100%. And once cancer spreads, that survival rate drops sharply to about 37% at 5 years. And it's not just about survival. Early detection often means less aggressive treatments, fewer side effects, and better quality of life. Large population studies also show that early detection through PSA screening can reduce prostate cancer deaths by up to half in some cases. So the takeaway is simple. A small exam today can give you the best chance at long-term health and peace of mind. Here are some tips to make the exam easier. Relax your muscles. Deep breathing helps. Use the restroom first. Less pressure on your bladder. Ask questions. Knowing what's happening reduces anxiety. Schedule at a convenient time. Being rushed adds stress. Don't forget, doctors are trained to make this as comfortable and efficient as possible. Remember, a prostate exam is routine, quick, and important. Nothing to fear. If you found this video helpful, give it a like, subscribe, and hit the bell so you don't miss more men's health videos from Targeted Science Studios. Also, share this with a friend or family member. Knowing what to expect can make all the difference.